Hello, today inshallah will be talk about verminous pneumonia. Introduction. Verminous pneumonia, also known as verminous bronchitis or lungworm infestation, is an infectious respiratory disease affecting ruminants and horses. It is caused by nematode parasite and present in acute, subacute, or chronic forms. Nematode parasite belong to genera Dictocalulus and Metastringulus and the family Protostringuli. These swarms are specific and inhibit bronchi and bronchioles. The common species in calves, Dictocalulus fifavarius, and in the sheep, Dictocalulus filaria. Life cycle of nematode parasite. In general, the worm lay egg in the lungs, which are coughed up, swallowed, and passed as larvae in feces. Larvae develop into environment into infective stage larvae, which are ingested by host after entering the intestine. They migrate to lungs via lymph nodes and bloodstream, then maturing into egg-laying adult within 3 to 6 weeks. Adults survive about 7 weeks before immunity clears them. Epidemiology. The disease is found globally, including in America, Africa, and Middle East, included Egypt. A transmission and mode of infection. Infection occurs when animals ingest food or water contaminated with infective third-stage larvae, and calves typically need to ingest 25 to 50 infective larvae per 1 kilogram to develop clinical signs. Hosts. Susceptible species include cattle, sheep, donkeys, horses, and ruminants, and the most outbreaks occur during cool season, especially autumn and early winter. Economic importance of the disease. The disease causes economic losses due to poor growth, reduced meat and wool production, and increased mortality. Pathogenesis. After infection, a 3-stage larva penetrate the intestinal lining and migrate to the lungs via bloodstream and lymphatic system, typically within 1 week without showing clinical signs. Once the lung, they enter the alveoli and the bronchioles, molt into adults, and move up toward larger airways as they grow. Clinical signs. There are two forms of verminous pneumonia: acute verminous pneumonia and subacute verminous pneumonia. Acute verminous pneumonia characterized by sudden onset of rapid and sometimes abdominal breathing, with symptoms including frequent cough, nasal discharge, fever, increased heart rate, rude lung sounds, and in severely affected animals may breathe with their mouths open with extended neck. In subacute verminous pneumonia, also sudden onset but characterized by diarrhea, mild fever, increased breathing rate, and frequent coughing. Lung examination may show ventral consolidation and bronchitis with dorsal emphysema, depending on disease stage and lung area affected. Postmortem lesion. Postmortem lesion show adult swarms in bronchi, enlarged lungs from edema and emphysema, dark pink collapsed lung tissue, and signs of hemorrhagic bronchitis with fluid in the airways and swollen lymph nodes. Diagnosis. Field diagnosis based on clinical signs and poor response to treatment. Laboratory diagnosis. Larvae are found in fecal and symptom sample about 12 days after clinical signs with high larval number. Differential diagnosis. Verminous pneumonia may present with clinical signs similar to those of bacterial bronchopneumonia, viral pneumonia, and both acute or chronic interstitial pneumonia, that making differential diagnosis is important. Prognosis. The disease has a favorable prognosis as it is self-limiting. Treatment: antibiotics are used to control larval reaction and secondary bacterial infection. The main antihelmintic drugs include albendazole, febendazole, oxybenzone, and ivermectin, which can be administered by injection or topical application. In the last, prevention and control include avoiding exposure to contaminated farm, administering 3 doses of ivermectin or levimazole when infection is detected, using a live vaccine for calves over 2 months old. And thank you.